Okay, you're all set. Thank you.
Good evening. This is calling to order a regularly scheduled Public Safety Committee, Monday, April 20th, 5:30 p.m. And with us today, as was at our last public safety meeting, is the Connecticut Central Health District. Charles, I'm going to entertain a motion, or can I have a motion to move old business in its entirety, section 4A and B, up to just after item 3.
So moved, Ed. You just need a second.
Second, all approved. All right. Aye. All right. Approval of the minutes, March 16th, 2020.
Motion to approve.
Second. They're approved. I don't believe we have any comments or emails in from the public. This is the public comment section. Seeing none, we will move on then to the new 4, which is old business, and we have an update from the Central Connecticut Health District. Thanks, Charlie. You got the floor.
No problem. Thanks for having me here tonight. So just an update across the district here with our 4 towns. We currently have 498 confirmed cases within the district. Of those 498 cases, 175 are within Rocky Hill. Also, we have 36 fatalities as of this afternoon that are COVID related, 13 of which are within Rocky Hill. Now, the majority of these fatalities really do fall within the age bracket that we were anticipating, that's 60 plus, and with 80 plus years being the most impacted by this. So we've seen as low as 47 within the district, but the majority, once again, does fall within that 60 to 80 range. One of the things I would like to say within Rocky Hill specifically, we've seen a lot of challenges with respect to nursing homes and congregate settings. So we've been working with the Department of Public Health and with infection control in several of our nursing homes with outbreaks related to COVID-19. It's gotten to the point to where they've reached out, trying to look for personal protective equipment, gowns, goggles, face masks, things of that nature. Last Wednesday, we actually received a small allocation from the Department of Public Health. It was actually the last equipment that they had within the Strategic National Stockpile. And we got a third, or we had a selection of that. And we actually took the majority of that equipment and we prioritized it to agencies that were actually seeing outbreaks. And I had some contact with folks afterwards, and they were saying that they were on the verge of seeing staff walk out because they didn't have the equipment that they needed. And what we gave them, the gowns specifically, was what actually helped keep their staff and keep them going. So, it was a good decision to make it that way. We continue once again to push the basic prevention messages that we have. The need for social isolation still exists and will continue to exist until we actually get a vaccine or pharmaceutical treatment to be able to fight this particular virus. At this point, we're still looking at a year to 18 months. It's hard to really fathom, considering the changes that we've gone through as a community, as a state, and as a nation, that we've only really been dealing with this, especially within the district, since March 13th. March 13th was the first confirmed case that we had within our 4 towns. And from March 13th until today, we've had from 0 to 498 cases. So, just to remind folks, that number, that 498, only represents those that have been tested for this particular disease. And testing remains one of the big challenges that we have. So there's still restrictions upon testing. We're actually getting some more testing and capability that's getting rolled out every day. But it's still not enough to really drive what we need to do as public health agencies to really curb this particular disease. And remember, for every case, the confirmed case that we see, we're anticipating anywhere between 8 and 10 times that number of actual disease within the community. So, I urge everyone as we continue to, fight this particular disease, to remember that, we're still seeing widespread cases. We're still in the acceleration phase of this particular epidemic curve. So we have not hit our peak yet. Now, speaking about that, there were estimates, I think about a month ago or less, that we'd be seeing our peak at about April 22nd. Now, that peak is actually, we spoke or heard from the state epidemiologist, Dr. Matt Carter, on Friday, and he said that they're actually pushing that peak out to mid-May. Now, that doesn't sound like good news, but it's actually very good news, because what it means is that we're actually flattening that curve down. So where that peak was going to happen very soon, we're starting to stretch those cases out over a time period. And that's exactly what we want to have happen in this case. Specifically, in the Hartford area, we've been very lucky so far. The wave that we see coming from New York into Fairfield County, New Haven County, is just starting to crest here in Hartford. So we're seeing hospitalizations here, but not to the level that they had, because we were able to actually see this coming towards us. And I think our hospitals have done an excellent job in helping to prepare, decompress their facilities so that they can deal with the surge that they know is coming. With that being said, we can't back off on the isolation protocols that we have, because that's what's keeping this surge at bay. With that, I'll be happy to answer any questions that I can answer and provide you any information that we have.
Yes, I would like to open it up to the two chiefs present, if they had any questions of you immediately before I go to council members.
I'd just like to thank Charlie for answering the phone whenever we call, and all the backup and all the assistance and the support you've given us. We appreciate it. This is all new to all of us, and stuff we've never seen before. So we appreciate everything you've done for us.
No, I mean, if I could do more, we would. And I hope that you guys know that. We really have tried to make sure that whatever calls come down the pipe, that we try to answer them. If we don't have the answer, we sure as hell do our best to try to find an answer for you.
Thank you.
We do have the mayor at the meeting tonight, and we appreciate that. Mayor Murata, do you have any questions for the health district, for Charles Brown?
Good evening, Charles. I want to reiterate what Chief Garahy said. I certainly appreciate everything that you're doing. And it's true, every time that one of us reaches out, you pick up the phone instantly, and you're always generous to offer your number to the public if they have questions or concerns. And it really provides a lot of reassurance, right, for the folks at home watching, and it reduces a lot of the anxiety. So I'm personally very appreciative of that. So thank you.
Thank you. We're proud to serve you.
Councilor Emmanuel, John?
I have a couple of questions. Charlie, there's some protests going on in Hartford right now about reopening business. What do you think about that?
Not much.
Okay. Straightforward. Good.
No, I mean, to be completely honest, and I'm sorry to be flip, but I think that it's very premature, especially with the information that we have, to really talk about reopening business wholesale. And even when we start to open businesses without a comprehensive testing that's very rapid and that gets the information to public health agencies so they can do the appropriate contact tracing and quarantine and isolation of those folks that have been affected, we really are courting disaster. And I don't say that lightly. The reason that we haven't seen the spread within, the communities that to the extent that we could have was largely by, the fact that we took decisive action up front. And being able to relax those without good information, I think is reckless in the extreme.
Okay, thanks. And I hope the mayor can convey that during the council meeting, during her comments tonight. People, just a few questions that I've received. People wearing gloves, good or bad, when they go into the store or whatever?
I think that gloves used properly can be a good deterrent. What we've seen in practice, though, is that gloves are used and not washed. They think they're a protection, but they really just become something else, a layer on the hands. And I would much rather see people washing and sanitizing their hands much more often than wearing gloves all day and thinking that that one pair of gloves that they have on all day is protecting them from this particular virus. The hand piece and hand hygiene is very important, but it's important because your hands are carriers to your face and other areas that actually can infect you. So just the fact that you have gloves on isn't necessarily protecting you. If you think about when doctors are in the hospital, what they do is they put on gloves before they do a procedure. And then when they're done with that procedure, they're taking those gloves off. So if you're not doing that based upon your actions as far as what you're engaging in, then I would much rather see people using the good old soap and water, washing their hands often, using the sanitizer where they don't have access to soap and water. Soap and water kills this virus. It's been proven. That's something that everybody should have access and should be taking advantage of.
Right, okay. Are there any risks from delivered packages like Amazon or grocery deliveries like Peapod? Do recipients, like residents, have to clean the boxes before they open them, or any special precaution? Because I've just received some concerns that they're just picking up the boxes and there could be some contaminants on the box from the multiple deliveries that box had gone through.
I think that the risk with boxes and things of that nature is minimal, but just as with anything, if you're handling items that are outside from your home, handle them, wash your hands, if you're unboxing them and dispose of them. That's the best bet, as far as that's concerned. So being able to open them, wash your hands, and then making sure that you're getting rid of the boxes. When you speak of groceries, just a reminder for people, things like produce, washing that effectively is a way to keep many different pathogens from help getting us ill. So making sure that you're washing your vegetables appropriately. Other things within the grocery store, as far as that's concerned, if you have the opportunity to wipe it off, it's probably not a bad idea, but I don't think that it's a major concern. Once again, anything that you're handling, especially with food preparation, making sure that you're washing your hands well, while you're dealing with food and before you eat becomes very important. That's one of the main ways that you can kill that virus, any virus that you pick up from that contact.
Okay. And my final question, Charlie, with the increased number of COVID positive people, or the ones that have are deceased, the tracing process, is that more challenging for someone that you hear becomes positive to trace their contacts over the prior couple of days? Is it more challenging now because of the number of people?
Well, right now, I mean, I think that it's actually fairly easy because of the restrictions that we have in place. So there's not that many social interactions that people have or can have during the day because of the social restrictions that we have in place. The problem that we have is the testing. Once again, I think testing is the first problem. The other problem is having the capacity to be able to do the appropriate contact tracing once we get that testing in place. That's our next challenge. as public health agencies, is trying to be able to work with our staff, work with our volunteers to really ramp up that capacity to do that contact tracing, so that when somebody is infected and we get notified, the time period between that notification and our contacting them for interviewing to determine who they've been in contact with so that we can put them under quarantine, that's how you stop an outbreak. So, right now, I think, having the isolation in place helps to limit the number of contacts that people see on a daily basis. So it actually helps us as an agency. Once we start to release those restrictions, it becomes that much harder because people have many more interactions during the day that we would have to potentially follow up on.
Great. Okay. Thank you so much, Charlie. Kudos to you and your staff.
Thank you.
Thanks, John. Counselor Prakash Pankaj.
Yeah, thank you, Charles, for all your hard work. I kind of second all the thoughts which were expressed about your great work. I have a couple of questions for you. Just going back to what you said earlier about the peak of the curve, right? So going back to the idea of social distancing versus the peak, right? The peak only solves the problem of hitting that number at a very rapid clip and getting into a problem of demand and supply vis-a-vis, let's say, ventilators, right? So just spreading out the curve does not really mean that we can relax and just go back to business as usual, right? In terms of social distancing. Actually, as a matter of fact, as I understand it, if you spread that curve out, actually, you should have more social distancing because those cases which are going to peak quickly are going to spread now. And the peaking was important early because of that idea of demand and supply, because you cannot have a million people in the hospitals when you don't have enough equipment, right? Mm-hmm. So it solves that problem, but it does not get us out of the woods in terms of social distancing and what we need to do. If I understand that correctly, I just want to send the right message to our audience.
Oh, absolutely. And remember, I mean, the only thing that's going to get us out of the woods with respect to this particular virus is when we have a vaccine or a pharmaceutical way to treat for this. That's what's going to get us out of the woods. Until then, all of these efforts that we're taking are all mitigation. So it's all trying to do what we can to keep the number of cases that we have below that line in the sand. That line is the healthcare, their capacity. Because once we get over that line, that's when you start to see more fatalities than what you can handle. So I agree with you. It's absolutely all the social distancing and things that we have in place really are put there as a mitigation effort. And until we have a vaccine, until we have a viable treatment for this particular disease, or when people are infected, the social distancing is really what we have in place to be able to hold that line and to keep those deaths from happening.
Right, and I have another question for you. Second question was, I was thinking about testing as you mentioned it a few times. If let's say someone is having a symptom, or symptoms rather, and he wants to get tested, what is the process to get that test right now? And I understand it's in high demand. Probably we don't have, the same, the demand and supply is not probably at a match. But if you want one, if you feel like you should have one, then what is the process?
Still the best way, if you feel like you need a test, is to contact your physician. And they still need to have physician orders primarily to be able to get tested. So they have started to roll out some rapid testing facilities like what you've seen on the news in New Haven. And those you still have to register for. And one of the primary questions that they ask you is, are you having symptoms? So if you're not symptomatic and you're not a priority group like first responders per se, it's still the physicians and still the symptomatology that's driving the need for testing. That's one of the main reasons why, right now testing is not driving a lot of the decisions, because we still don't have the mass availability of tests that we would need to be able to say conclusively what's really happening within our communities. It's still, the tests that we're seeing and even the confirmed cases that we're seeing are only those people that are the most ill and most affected and generally hospitalized. Either that or they're people in priority groups like healthcare facilities and their staff that are getting tested. So until we actually start to see, that testing really ramp up to the point to where if you want to get tested, you can go in and get tested. We're still going to be fighting this one for the long haul.
So the shortest path is if you feel like you have symptoms and you go to your doctor, your physician, and he
doctor.
can route you to the right.
Going to your physician is the shortest path as far as that's concerned. And it also makes it the most appropriate one. Because remember, with the case right now, there's still limited testing available. And we want that testing to be able to go to those who absolutely need to have that confirmed. A lot of cases that we see within the community are presumptive cases. They're following the symptomatology for the disease, and they're presuming that that's what you have. And then they're being told, especially in cases where they're not in serious need of medical facilities, to isolate at home and treat it appropriately. And that treatment really is rest, hydration, and supportive care for the symptoms.
Thank you. Thanks, sir.
Thanks, Pankaj. Joe Greb from Ambulance EMS. I didn't mean to cut you out when I asked the chiefs to ask questions, but do you have any questions of the Central Health District? I assume you're working more closely with
Yep.
Charlie than the rest of us, for sure.
Yeah, nope, they've been great. We've had no issues, and so far everything's going well. So no, I'm fine.
Sure. John, Mayor?
Charlie, have you heard anything about the governor moving the schools from May 20th to probably not coming back at all yet?
I haven't heard that per se, but it would not surprise me at all, to be honest. And just because, once again, until we have the capacity of testing to be able to say that we can have large groups be together, it's just not a good idea to bring them all in one place. And so the school setting, as we know it, in a normal year, it's not going to be something that I think we're going to have resolved by that June, July timeframe.
Okay. Thank you.
By the way, did I mention that my middle name now is Buzzkill?
No.
No.
Well,
Breaking
One word or
news.
two.
I think it's all one word.
Buzzkill.
Yeah.
Charlie, my questions for you center around the masks, since that seems like a central activity now that everybody can work on. And I don't know if you can spend a moment or two talking about masks, and in particular, we have a lot of mask makers locally that are getting masks into the hands of folks in their neighborhoods and around town, the cloth masks. And how do they go about airing them out and cleaning them? Maybe they have 2 cloth masks and they rotate. What would you suggest for cleaning those and getting them properly aired out?
Well, CDC is recommending that if they have cloth masks or face coverings, that those be washed once a day. So if you have more than one, you can kind of rotate through, wash one, dry one, use one. So, having multiple masks in that way makes a lot of sense. If you only have one, wash it, in the evening before you go to bed and get up and go about your business the next day.
Soap and water?
Soap and water, once again. Soap kills this particular virus. So soap and water, high heat temperature is what you want to look for to be able to kill this particular virus.
I just have visions of folks spraying the alcohol spray into it and putting it over their mask and asphyxiating or something. I mean, soap and water.
Soap and water is really what you need.
And then dry it out.
Take it back to the basics, soap and water, let it dry overnight. Like I said, if you have to, you can wash one, let it dry for a full day, use the other one, and then, kind of alternate as far as that's concerned. Just a reminder for folks on mask. One of the things with people, and this is a cautionary tale that we had at the beginning of this process, when people ask us about mask use, is as they're wearing masks, if you don't wear a mask very often, or it's not what you're used to, you have a much higher tendency to touch your face and adjust your mask. And that's one of the ways that people end up getting themselves infected with this particular disease. So just remember that for the most part, those masks don't have an S on them like Superman. So make sure that even when you're wearing that you're washing your hands appropriately, washing them often, not trying to touch your face and adjust that mask on a regular basis, because that is a way that you're carrying that virus up into your face and actually can contract it at that point. I think that's just a good message for everybody to know. We want to make sure, and I think that it's a new practice here in the United States, and will be around the world. When you're wearing that mask, it's not protecting you per se. What you're protecting is everybody else. So that mask is actually holding in any droplets that come out if you were potentially infected. And remember, some things that we've learned about this particular virus over the last month. At the beginning, when I was talking to you last month, we were talking about when people were infectious when they got the fever. What we've found now is that it's a 2-day window before they become symptomatic that they could potentially spread this virus. So even though you feel fine, if you contracted this virus for 2 days before you start feeling sick, you could be spreading that. And that was one of the things that really precipitated this change in policy, because the ability to cover your face and keep you from spreading droplets really does help to protect not you, but the rest of society.
I always felt some barrier was better than no barrier, even if it was less effective in the hands of a non-professional. It's still a barrier.
Yeah.
But
and
that
I
being
think,
said,
yeah.
we're now back. Now we're on the course of telling folks to use these cloth masks when they're out, or a scarf or whatever.
Mhm.
So that's great. Hey, Charlie, what are your credentials for the public? Are you a doctor or a
No, I'm not a
licensed
doctor.
healthcare?
I have a master's in public health. So I've actually been trained in the public health practices and all of the things that we do. On top of that, my experience within the public health realm, I've spent the majority of my career planning for things just like what we're dealing with today. So I had a military background. I worked for the Connecticut Association of Directors of Health for 14 years, right after 9/11. But more importantly, for the public health world, it was after the anthrax attacks. So I've spent the majority of my career training local health departments for things like how we do smallpox vaccinations, how we react in an anthrax attack if it was bioterrorism, for pandemic influenza, and exactly for this type of emerging infectious disease. So this is the thing that I actually had professionally trained for my entire career until I took the job at Central Connecticut Health District. So you might have gotten a little bit lucky just because I got a little bit more experience than a lot of folks, in dealing with these types of plans. That being said, the good thing about being with the district is it's not just me. We have a variety of our staff that have good experience, that have trained with the plans, and we've got a wonderful team to back me up and to back up our 4 towns.
So you do provide numbers to the emergency management team at our regular meetings. So we appreciate that. Keep the numbers coming. It helps us understand where we are in that curve. So that's very helpful. I think all would agree. Any comment on the vaccines or the drugs that you can offer, or any information you're hearing? Any buzz? Not buzzkill.
Well, no. I think one of the best things that I've heard thus far is the studies that are coming out around the use of plasma from those who have been positive. So there's a study being done at UConn Health Center, for example, from healthcare workers that they're taking blood donations and deriving immune plasma and trying to see if that will work as a treatment for some of those most affected by this. So some of those treatments I think are going to come about as we've been following up with individual cases to see how they're doing, to provide information on quarantine and isolation protocols. We've been reminding folks of that, that if they have been confirmed positive, that they can contact the American Red Cross and let them know so that they can get on the list for potential donations. So it's that type of thing that I think is encouraging in the short term. In the long term, remember that the race for a vaccine is exactly that. And right now they're racing to do that. The fact that we're still looking at 12 months to 18 months for development before we have a viable vaccine is just the truth. And believe me, developing vaccine at that speed is very, very quick because of the number of human trials that we have to assure that we have a safe and effective vaccine. So a lot of the social isolation and mitigation protocols that we have in place right now are still going to need to be in place until we have that in our hands. So I urge people, and I've said this many times, the 3 words that should be ringing in our ears as we go through this process right now is stay the course. Make sure that we're still doing the things that have kept us safe thus far, and more importantly, kept those vulnerable populations safe. Because what we've seen when this particular virus gets into one of these populations, the fatality rate is really, just incredible.
So that gives us some visibility, right? People like to know where they're aiming themselves towards. And it sounds to me like, we're staying the course with all the actions that we're doing now and maybe finding a way to work, but not relaxing any of these guidelines. But it's the vaccine and it's the 12-month duration of the trial to get the vaccine. So that's the track we're on to the general public. Yeah. Yep.
Mm-hmm.
I think Mayor had a question.
Yeah, may I ask a question? Can we just go back to the masks for a second? Because I saw something on the CDC with respect to the age limits, right? And not putting them on infants or toddlers.
Mm-hmm.
And then if you go on social media, you will see, not necessarily family from Rocky Hill, but families generally wearing the mask, and then it's on a little baby. So did you want to speak to that?
Yeah, I mean, it's not a recommended practice. It's not something that, as far as you want to be able to do that, just because, obstruction of the airway for an infant is not really something you want to see. I know people are concerned, especially about children and them contracting the virus. So the main thing that we can say for protection there is keep them at home. That is the best protection that we have. That if you have to go out someplace that's essential, doing that, being efficient in what you're doing, not being out there in the public if you don't need to be. Once again, on the other side of that equation, being able to get out, exercise appropriately with the proper social distancing and the proper face covering is something that I think people need to take advantage of as well. But remember, it's with the proper social distancing. What we don't want to see is people going to the ice cream shop and hanging out in groups of 15, 20 people. We don't want to see people, playing football or soccer or basketball because just the close physical contact really does give this virus an opportunity to spread within the community. There's going to be time for that. Right now, we just have to put it on pause and stay the course.
Okay.
Yeah, while you were speaking, I had a question just come to my mind is, I've been hearing over the news, obviously, of as the testing becomes more prevalent and it becomes more of a surveillance kind of testing, where you are we can essentially go out and have a test even if you're not having a symptom. And looks like that is one of the essential conditions of getting back to normal. So in that scenario, what I want to bring it back to is how well prepared are we in terms of resources, in terms of the health district, right? Because everything I hear is about getting to the local level. Even I heard the governor talk about that, and the president, obviously. So everything is going to be done, it seems to me, through the local level. And I just wonder, because, and in the context of, not the least, in the context of our budget season,
Yeah.
this is one of the things I wanted to, like, it occurred to me that she should ask you about. How do you feel about the resources you have, and what do you see in terms of this playing out in that context in the next year? And I hope, like, I'm not talking about and scaring people talking about it in a year context, but
No.
maybe 6 months, whatever is the right context.
No, and that is, as I said, that's the next thing that we've been planning for, is trying to figure out where we're going to get the amount of staff, the amount of volunteers that we need to be able to do that contact tracing effectively. The good news is we have good volunteers. So CCHD has actually had a core of volunteers. A large number of them are nurses or medical professionals that are retired, that have the appropriate training to be able to do this type of follow-up, or could be trained to be able to do this type of interviewing and follow-up. So, you know, what we're trying to figure out now, and I think that everybody around the country is trying to figure out, is really how many of those folks we're going to need to be able to do this efficiently and effectively. Because stopping an outbreak really means that that time between when we get that test result and the time that it takes to contact that individual, figure out who they've had contact with, and then get them quarantined so they're not infecting anybody else, that's the limit of spread. So each hour, each day between that test result and that contact becomes critical time period, because that just gives that opportunity for more exponential growth. So I wish I had an answer for you to be able to say, yeah, I could use 50 more staff to be able to do this particular thing. I don't have that type of answer. I will say this, and that, you know, ultimately, you know, public health, and especially at the district level, we try to be as efficient and as effective as we can to be a cost-effective source of public health services for each one of the towns that we have. When we deal with extraordinary circumstances like this, it's a reminder that that foundation that we have in place is what we build upon in terms of a crisis. So if we have a good foundation, and I've got a preparedness coordinator that spends time to make sure that those volunteers are trained and that our plans are tested, that's what allows us to build in a crisis when we need to. So that's really, I think, the best answer that I can give you is, you know, would it always be great to have more funding, to have more staff to be able to address and plan for these types of things? Absolutely. But, you know, we try very hard to work with what we have so that we can be an effective and efficient agency for you guys.
No, thank you, Charles. That's very encouraging to know. I think that basically you answered my question. I was just getting to, like, the idea of the preparedness and being you know, fully you know, resourceful, like, to the extent that we can be. And it looks like that, you know, we are at a good spot with you there. So
yeah, and I will say that Central Connecticut has been probably one of the most prepared by having volunteers that serve us every year. These are the same people that when you go to the flu clinics, that they're the ones that are there to provide that flu shot. And we have a cadre of volunteers that are willing to step forward. In addition to that, I have to really thank the town and all of our towns, because when we have a need, especially in this particular scenario, we may call out to them and say, hey, Public Works, we need this type of equipment, or we need this type of facility. And it's that cooperation on both sides of the equation that really will allow us to get done the things that we need to when we have that vaccine in place.
thank you.
John, Emmanuel, any additional questions?
I'm all set, Ed. Thanks.
You're all set? Okay. All right, well, thank you very much. I'll start with maybe fire. Chief Garahy, any report to give on, or anything to add from your silo?
He's a hard act to follow. We've been on, I'm not even sure the word, but just limited house duties now for about a month. We've restricted training. We still have weekly functional testing and inspection of equipment and apparatus that occurs. You have the reports on the our call volume, which we're starting to see an uptick in it. You also have the inspection reports from the fire marshal and the deputy fire marshal, as well as the incident summary. And we did have a structure fire last week with some damage, some significant damage to the house. And we've got the family working with the Red Cross, and and the Red Cross is just phenomenal. They're coming out there and helping them. So really pretty much a bridge report tonight.
Thank you. Any questions, Councilor Emanuel? Councilor Punkage, Prakash? Any questions?
I'm here. Thank you.
Mayor? Any questions for, nope. Chief Custer?
Yeah, kind of same thing as fire. It's a kind of an abbreviated report. It's been extremely quiet for us. You know, for the most part, people in the community have been isolating at home, and we've seen it in terms of our calls for service. We're down 37% this month, March, I should say, from 2019. So yeah, it's like 1,200 calls less this year. So things have slowed down. Basically, we changed some of our policies that had to do with dealing with routine calls, routine complaints. We're handling a lot of those over the phone. We're trying to minimize contact with other individuals in the public as much as possible. Then the staff here at headquarters, basically restricting people from coming in the building even unless they have to. And it's all seems to be paying off because thus far, we've only had 5 employees that we've had to sporadically have quarantined. And happily, all 5 of them went through their quarantine period and were fine and have returned to work. So we're full staffed. We have enough PPE supplies on hand. We got a good 45 to 60 day supply here. So we're comfortable with that. I did have one comment and then a question for Charlie. And the comment is, I'm just a little concerned as the weather gets warmer that it's going to become more and more difficult, Charlie, for people to isolate at home. And I think we saw a snapshot yesterday when I reached about 60 degrees and I saw large groups of people in backyards. I understand the parks and hiking trails were very busy. And I agree that the social distancing and isolating has kept that curve flat, but this is going to be difficult to maintain, I think, as the weather gets good and people are just itching to get out.
Oh, I wholeheartedly agree. And once again, I think that everything that we can do across the board to be able to get that message out, that the reason that we haven't seen the spread of this disease is that people have taken these restrictions seriously. And I think that as we start to see people relax in this, I think the numbers we're going to see those spikes. And I think that the opportunity for us to communicate when that happens, from every agency becomes very important. So I urge all of you, from the fire to police, the town, each counselor, the mayor, get that message out as broadly as you can. That with the weather coming, we want people to get out and we want people to be able to take advantage of that for their health. to be able to exercise appropriately. But once again, the word there is appropriately, and that means with proper social distance and proper precautions.
And that kind of leads into my next question, which is kind of a softball question, but I'm going to ask it nonetheless. In your professional public health opinion, should this year's Memorial Day parade be canceled?
Yes. And once again, that's where my nickname comes from. Because in the same day, and I'll throw Weathersfield under the bus. I got asked if the senior prom should be held and the Memorial Day parade in the same day, and I had to put the kibosh on both of them. So that's where I got Buzzkill as a nickname. But you know something I've said from the beginning of this, I'd much rather apologize for the inconvenience of these things than have to offer condolences to anyone, because we're going to have to do that way too often as it is. So, I think that it's an inconvenience not to be able to have these. And I encourage you, as a town, to start thinking about creative ways that you can celebrate and remember, especially Memorial Day and the proms and those types of things. Think about ways to be creative on how you can do that and provide that celebration in an appropriate way.
Thank you. That's all I have, Ed.
Any questions for the Chief Custer? John?
No, thanks.
Mayor?
Yeah, Chief, we were out yesterday, the kids and I, and we went to some of the parks just to see what was going on. So I noticed that we don't really have those social distancing signs that we have up at, the school and Maxwell or Elm Ridge. So is that something that, we should probably get up at those parks, like Dividend and the walking trails?
I think that would be a good idea. Maybe we could work with Park and Rec, at least at the entrance to those trails and so forth, some kind of signage. In addition to, I've talked to Lieutenant Phelps. We're going to try to get especially on the weekends, our ATV vehicle out. Hey, it's
That's what it's for.
It comes in handy. And we've gone out a couple times and people were really surprised to see us out there. And it's, it's good, community policing, but also just to remind them, please, stay in groups smaller than 5, distance yourself. So we'll pick that up as well. But yeah, we could reach out to Park and Rec on the signage.
Well, Ed and I will volunteer to go on the ATVs with you.
I was going to say, put them on that. You got a police bike?
Get a trailer, I'll come.
Any other questions for the Chief Puckett?
Yeah, Chief, quick question. Like it's under the circumstances, it's only expected that your call volume is down, which is great. One question I've been like reading in the media a lot is like domestic disturbance numbers going up. Do you see any of that in our town, or because I guess people are spending too much time with each other? I don't know.
Yeah, it spiked a little bit last week for the first time since we've implemented this isolation at home. So we saw a little spike last week, and we were a little concerned. Oh boy, is this the beginning? And then it dipped right down again. So happily, there's no pattern as of yet. So hopefully it stays that way.
Yeah, hope so. Thank you.
Joe Greb, ambulance and EMS.
Yeah, we're doing great. Our call volume dropped about 10% for the last month or so. And just this week, it started picking up again to a little bit more than normal. So we're definitely seeing the call volume coming up for respiratory precautions. A lot of people with about a third of our calls now are difficulty breathing or respiratory precautions. So we're doing great with PPE stuff. We've got at least 6 weeks, if not more, of coverage for all of our people. And nobody's been out of 120 calls or so. Nobody's had any issues. Everybody's has been healthy. So, that's just respiratory calls. What's the normal aim? We've instituted a couple of weeks ago that any of the respiratory calls at all, everyone's completely gowned, masked, eye protection, and everything. And all of our facilities now, assisted living facilities, convalescent homes, the Veterans Home and Hospital, OPPE for all our members going into all of them. So definitely paid off because, like I said, we've done 100 plus calls and nobody's been sick on our side. Doing good.
Any questions? Councilor Emmanuel?
I'm all set. Thank you.
Councilor Pankaj Prakash?
I'm good. Thank you.
Excellent.
Mayor? No? No? Okay. Thank you very much. John, did you want to add anything to public safety or have any questions of anybody? John Mayer?
Not really. We covered a wide range of areas tonight. The only thing I can say is that on a FEMA side, they did have a webinar last week on the process to get reimbursement for expenditures that qualify for FEMA reimbursement. It's encouraging. It sounds like they want to pay on a fairly quarterly basis and so on. But the concern is that this is a 50-state emergency, where usually in the past it was maybe a handful of counties. So the question is how quick the money's going to turn around and come out. But at least they are trying to streamline it and make it easier than past FEMA documentation. That's it for me.
New business, we have none. Any new business? Otherwise, I'll entertain a motion to adjourn.
Motion to adjourn.
Second.
All in favor? Aye. Thank you, gents. Be
Thanks, Ed.
safe.
Take care.
Thank you, everyone.